Welcome to today's study presentation, Vaping, Pills, and Beyond, Understanding Emerging Substance Use Trends. We're living in a time where substance use is shifting, and it's shifting fast. What used to be seen as just experimenting is now more complex and more dangerous. From flavored vape pens to counterfeit pills laced with fentanyl, the landscape of substance use is changing, especially among youth and young adults. This isn't just about substances. It's about culture, coping, access, and risk. Before we get started, let's take a moment to go over what we'll learn in this study presentation. By the end of this session, you'll be able to identify the latest trends in substance use, including the rise in vaping and the misuse of prescription medications, recognize the social, cultural, and environmental factors that are driving these emerging trends, because substance use doesn't happen in a vacuum. We'll assess the impact that these substances have, not just on physical health, but also on mental and social well-being. To support your understanding, we'll start by reviewing a few important terms to make sure we're all on the same page. Then we'll walk through a brief case study to bring these trends to life in a real-world context. You'll have a chance to reflect on what you've learned with a few guiding questions. And finally, we'll wrap things up with a quick quiz, just to check your knowledge and reinforce key takeaways. From vaping to synthetic drugs, new trends are emerging, shaped by culture, technology, and access. These shifts are raising serious concerns, especially around mental health, peer pressure, and economic stress. In this study presentation, we'll explore what's driving these changes, how substances are marked, their effects, and the strategies that actually work to intervene. Let's define a few key terms. We'll look at adolescent substance use, the powerful role of peer influence, and the rise of THC vaping. We'll also touch on the academic stress and risky behavior that it causes, and why parental involvement is a critical part of prevention and support. Before we dive deeper into today's topic, let's take a moment to review a few key terms that will come up throughout this presentation. These terms help us build a shared understanding of the issues at hand. Adolescent substance use refers to the use of drugs or alcohol by individuals typically aged 12 to 17. This stage of life is shaped by rapid brain development, emotional growth, and social changes, all of which can influence the decision to experiment with substances. Peer influence is the pressure or impact that a peer group can have on a young person's behavior. Whether direct or subtle, peers often play a role in normalizing or even encouraging risky actions like substance use. THC vaping involves inhaling THC, the psychoactive ingredient in cannabis, through an electronic device. Many teens view it as a safer way than smoking, but the risks, especially during adolescence, are still very real. Next, we have academic stress, the pressure students feel to perform well in school. When this stress goes unmanaged, it can lead to unhealthy coping strategies, like the misuse of prescription stimulants. And finally, parental involvement is key. This refers to a parent's role in recognizing warning signs, navigating support, and helping teens with mental health and substance use related challenges. In this brief case study, we'll explore how vaping and prescription drug misuse impacted one teen's life, examining the role of peer influence, access, and mental health. Maria, a 16-year-old high school junior, was referred to counseling after her teachers noticed a decline in her academic performance and a pattern of unexplained absences. Maria's parents report that she has been irritable, secretive, and spending most of her time in her room or with new friends. During an initial session, Maria reluctantly admits to vaping THC and using a prescription stimulant she obtained from a friend to help with studying. Maria explains that vaping THC is less harmful than smoking and that the stimulant pill was a temporary solution for managing her academic stress. She is unaware of the potential risks, including dependency and the negative impact on her developing brain. Maria's parents are shocked by her admission and unsure how to help her. They express concern about her peers' influence and fear that she might be using other substances. Let's take a closer look at Maria's case and identify some major concerns that are showing up. First, we're seeing a decline in academic performance and unexplained school absences. These are often early red flags that something deeper is going on, especially when they appear suddenly or without a clear reason. Maria also has become more irritable, secretive, and has started changing her friend group. These behavioral shifts may suggest emotional distress or new influences in her social environment. We've learned that Maria is using THC through vaping and misusing prescription stimulants, substances that are increasingly common among teens but carry serious risk, especially during brain development. Another concern, Maria seems to lack awareness of the long term consequences of these substances, both physically and mentally. This gap in understanding can lead to riskier choices over time. And finally, her parents are deeply concerned, but uncertain about how to intervene in a way that's helpful and effective, a feeling many caregivers share when navigating teen use. As we continue, keep these concerns in mind. They help us understand not just what Maria is experiencing, but also where to support and intervene. Take a moment to answer the reflection questions based on Maria's case. Thinking critically about what you've learned helps deepen understanding and boost your ability to recall key concepts when it's time for your licensing exam. It's not just a review, it's learning in action. What specific strategies would you use to assess the severity of Maria's substance use? As you think this through, consider a few best practices that can guide your responses. Start with a developmentally appropriate screening tool like CRAFT. These tools are designed specifically for adolescents and can help identify risky use patterns early on. Follow up with open-ended, non-judgmental questions. Ask about how often she's using, how much, in what context, and for how long. This helps build rapport while gathering important information. It's also essential to explore the functional impacts of her substance use. Has it affected her grades, her friendships, her physical or emotional health? Don't forget to assess for co-occurring mental health issues such as stress, anxiety, or depression. Substance use rarely happens in isolation. You'll also want to consider risk factors for escalation, like easy access to substances, peer influences, and family history. And finally, gather collateral information with consent from parents, teachers, and school records. These perspectives of what Maria is experiencing. Take a moment to reflect on how you would approach this and what tools or strategies you might add to your clinical toolkit. How would you address Maria's misconceptions about vaping and prescription drugs? This reflection question asks you to think like a supportive guide, not just in correcting her behaviors, but helping her to understand the real risks behind the choices she's making. One of the most important tools you can use is age-appropriate psychoeducation. Maria needs to understand how substances like THC and stimulants affect her developing brain, and she needs to hear it in a way that makes sense for her age and level of understanding. You can also incorporate scientific evidence and visuals, things like videos, brain scans, or infographics to make the long-term effects of substance use more concrete and relatable. Next, consider motivational interviewing techniques. This means having a calm, respectful conversation that gently explores the gap between what she believes and what the research shows, without judgment or pressure. It's also key to clarify differences between using stimulants as prescribed versus misusing them. Maria may think prescription equals safe, but that's not always true, especially when they're not prescribed to her. And finally, encourage critical thinking by asking reflective, open-ended questions. For example, what might happen if you use, or what might happen if you continue to use the way you use now? Or what do you think your future self would want to know from you right now? What cultural or environmental factors might be influencing Maria's behaviors? When we're trying to understand substance use in young people, it's important to look beyond the behavior. We need to ask, what's happening around them? What pressures or influences are at play? In Maria's case, there may be several factors shaping her choices. She could be facing academic pressure, whether it's coming from herself or her family or the school. That pressure to perform can sometimes lead to teens to experiment with substances they believe will help them stay focused or reduce stress. There's also powerful influence of peer groups. Maria may be seeking social acceptance, trying to fit in, or simply influenced by what others around her are doing. And then there's the media. where vaping and study drugs are often portrayed as normal or even glamorous. Without critical thinking or guidance, teens can easily absorb these messages as truth. Another important factor, her home environment. If open communication is missing or if emotional support isn't readily available, Maria may be turning to substances as a way to cope. We also have to consider access. If THC vapes or prescription pills are available in her school or community, the barrier to experimentation is lowered. Finally, there may be stigma. Maria might be afraid to ask for help, worried she'll be judged, labeled, or misunderstood if she opens up about her academic and emotional struggles. Take a moment and think. If you were supporting Maria, how would you address these deeper cultural and environmental influences? This question reminds us that behavior is just the tip of the iceberg, and real support starts with understanding what's underneath. How would you involve Maria's parents in the intervention process while respecting her autonomy? This is a powerful reflection question and a common challenge when working with teens. How do we bring parents into the process in a way that supports the teen without taking away their voice or independence? Start by scheduling family sessions that promote open, respectful communication. These meetings aren't about blame, they're about creating a space where everyone can be heard and healing can begin. It's also essential to educate parents about adolescent brain development and the realities of substance use. This helps reduce fear and frustration and keeps the focus on support, not punishment. Be clear about confidentiality boundaries. Explain what information will be shared in family sessions and what will remain private to help maintain Maria's trust. Give parents specific supportive roles like monitoring safety, encouraging healthy habits, and helping to set consistent structure at home. When parents know how to help, they're more likely to stay engaged in a helpful way. Encourage them to practice active listening and emotional validation. Sometimes the most healing thing a teen can hear from a parent is, "I believe you," or "that sounds really hard." And lastly, equip parents with resources and coping strategies to manage their own stress and anxiety. When parents are regulated and informed, they can provide a stronger, more grounded presence for their child. Take a moment to reflect. How would you balance Maria's right to autonomy with her parents? What would that look like in action? What evidence-based approaches would you incorporate into Maria's treatment plan? As you consider your response, think about how each intervention could help. You might start with cognitive behavior therapy, or CBT, to help Maria identify unhelpful thought patterns and build healthier coping strategies. Motivational interviewing, or MI, could be effective for exploring any ambivalence she might be feeling and increasing her motivation to make positive changes. We should also consider a family-based therapy like functional family therapy or multidimensional family therapy to address dynamics at home and create a stronger support system. Psychoeducation is essential too, not just for Maria but for her family as well. Helping everyone understand the risks and developmental impacts of substance use can be a game changer. Don't forget the importance of skill-building interventions. Teaching stress management, decision-making, and refusal skills can empower Maria to navigate real-world challenges more effectively. Depending on her level of need and readiness, a referral to peer support or teen recovery programs could also be appropriate and provide that extra layer of accountability. And finally, it's crucial to include regular monitoring and follow-ups. Treatment should never be a one-size-fits-all. It needs to evolve with progress. So based on everything we discussed, which of these approaches stand out to you? What would you prioritize in her care plan and why? It's quiz time. Take a moment to read each question and choose the best answer. This is a chance to reflect and reinforce key points. What is one of the most common misconceptions about vaping? Is it A, it is harmless compared to smoking? B, it contains fewer chemicals than traditional cigarettes? C, it is less addictive than nicotine products? Or D, all of the above? These are all common myths that make vaping seem safer than it really is. The truth is, vaping can still deliver high levels of nicotine, harmful chemicals, and lead to addiction, especially in younger users whose brains are still developing. Which of the following is not a risk of prescription stimulant misuse? Is it A, increased focus for academic performance? B, increased heart rate and blood pressure? C, risk of dependency and addiction? Or D, disrupted sleep patterns? The correct answer is A, increased focus for academic performance. Now this one can be tricky because while some people misuse stimulants hoping to boost their focus or perform better, that outcome is not guaranteed and it doesn't come without risks. In fact, misusing stimulants without a prescription can lead to serious side effects like increased heart rate, high blood pressure, disrupted sleep, and a high risk of dependency or addiction. So even if the intention is productive, the reality can be harmful, especially for young people. What is one factor that drives adolescent substance use trends? Is it A, increased parental supervision? B, peer influence and social pressure? C, greater access to community resources? Or D, lower levels of stress? The correct answer is B, peer influence and social pressure. Peer influence is one of the biggest drivers of adolescent substance use. Teens are heavily impacted by the behaviors, attitudes, and expectations of their social circles, especially when it comes to experimenting with substances like vaping and prescription drugs. While other options may help protect against substance use, it's peer pressure that often opens the door. What is a key component of an evidence-based treatment plan for adolescent substance use? Is it A, punitive consequences? B, family involvement in education? C, isolation from peers? Or D, avoidance of therapy? The correct answer is B, family involvement in education. Effective evidence-based treatment plans for adolescents almost always include the family. Why? Because family dynamics, communication, and support systems play a huge role in both substance use and recovery. On the other hand, punishment, isolation, and avoiding therapy can actually increase the risk of long-term issues and disconnection. According to research, why are adolescents particularly vulnerable to substance use? Is it A, they are more likely to have more financial independence? B, their brains are still developing, making them more susceptible to addiction? C, they have more access to resources for managing stress? Or D, they are less likely to be influenced by peers than adults? The correct answer is B. Their brains are still developing, making them more susceptible to addiction. During adolescence, the brain is going through major changes, especially in the areas related to decision making, impulse control, and reward sensitivity. This makes teens more likely to experiment and more vulnerable to developing a substance use disorder. Understanding this brain-based vulnerability is key to early intervention and effective support. Let's review key takeaways from today's study presentation on emerging substance use trends. First, we've seen that vaping and non-opiate prescription drug misuse are on the rise, especially among adolescents. These substances are often misunderstood as safer alternatives, which makes early intervention even more important. Next, we looked at the factors influencing substance use, including peer pressure, cultural norms, mental health struggles, and easy access. These dynamics shape patterns of use across both youth and adult populations. We also explored the risks and misconceptions. Teens like Maria may not fully understand the potential dangers of THC vaping or stimulant use, which can lead to addiction, memory and focus issues, and serious long-term health effects. And finally, we discussed counseling strategies that work. These include assessment, clear age-appropriate psychoeducation, family involvement, and the use of evidence-based approaches like motivational interviewing and cognitive behavior therapy. Understanding these elements helps us respond with empathy, strategy, and support, and make a real difference in the lives of those who we serve.